Welcome to another episode of the 340Banter podcast. Today, Logan and I are joined by Chris and LaNika as they share their journeys to a career in 340B. So we've done an episode in the past about the journey into a career in 340B from the perspectives of Michael, our CFO, as well as from Logan's and my perspectives in pharmacy, or from a pharmacist point of view. But you both have very different journeys into your 340B careers, and we wanted to talk a little bit about how you got here. Which one's gonna go first?
I'll jump right in. So, my journey started as a pharmacy technician at our entity-owned pharmacy. And for my entity, before the staff that I work with, the hospital staff was running their pharmacy for them. So they wanted to hire their own staff. And
So was your health center associated with the hospital?
yes,
Okay.
they were. The hospital is actually one of the reasons why they became FQHC. So I get there, I'm excited, come from retail, CVS, and going into the entity-owned pharmacy was very different. There was a lot of things that I seen that in retail would already be done. So like outreaching to patients, calling them about their medicines that you just don't have the tools for in a new entity-owned pharmacy. So I walked in being just a regular old pharmacy technician. And then I learned that, we're a 340B pharmacy. What is 340B?
Everybody likes some alphabet soup for fun.
So asking the questions around, I didn't get a lot of answers. So I started to kind of do my own research to learn about 340B. And then I moved into the lead technician, just organizing the pharmacy, making sure we were reaching out to patients, and organizing workflows. And then I realized that as an entity-owned pharmacy, we should be doing some type of audits, and then trying to figure out where to start. So
they already had the 340B program running, but there was just kind of no oversight really
at the time. They didn't have any contract pharmacies at all. Then it was just the entity-owned pharmacy. And they were not yet administering 340B drugs in their clinics either, which down the line that plays into the long journey of 340B. So it was brought to our attention that we should be doing some type of internal audits, and I was assigned the task of doing the internal audits. So I scoured the internet trying to figure out, what are these internal audits?
And
what is 340B? And at the time, I seen a lot about hospitals, but not a lot about FQHCs.
Which is a lot of GPO prohibition stuff.
Yes.
You get what you need, but it's also accompanied by a lot of extra noise.
Things that don't apply to health centers.
Yeah. So I read the policy and procedure, the 340B policy and procedure, and kind of went down a rabbit hole. So I kind of started to take ownership of wanting to learn everything 340B. So I started with just the internal audits for our entity-owned pharmacy. I later became the 340B compliance personnel, where I was the lead pharmacy technician, as well as doing the 340B compliance at the time for just our entity-owned pharmacy. Then we started to rapidly add contract pharmacies, which was a whole nother learning curve around the compliance there.
Especially because your background was an entity-owned pharmacy where you have control over all of the pieces of the puzzle. Yeah.
Right. Luckily for me, having a medical background outside of the pharmacy, working as a nurse's assistant, I knew charting systems. So that also helped me with learning, what am I looking for in the chart? How do I find a drug order and trace it back to, the prescription, the patient? So they asked me to be the 340B personnel, and they told me that 340B basically ran itself, which we all know is not the case. So,
and if you think it's the case, you're sorely mistaken.
So I kind of Just it was a journey with stepping stones in the career path. It was like building blocks. Started small with the entity-owned pharmacy, then learned about contract pharmacy compliance and took over compliance for that. And after I really learned about the compliance, it was enough in itself that I didn't have time to also work out in the pharmacy, filling prescriptions. So I took over that. And then I discovered that we were indeed ordering 340B drugs for our clinics.
A common surprise, unfortunately.
Right. So I also took over doing audits for our clinics, tracking profit, loss, and just the ins and outs of 340B, and started to educate the rest of our staff about it. And I fell in love with 340B. And being that with FQHCs, there was not a lot of knowledge out there. So being the resource for others in the area that may have been a 340B.
It doesn't take long till people start asking you questions and you
Yes.
still feel you've got that imposter syndrome because you're still learning.
Right. And I think with 340B, it's one of those type careers where you either really love it or you hate it. And I loved it. I love what it did for the people. So my career path kind of ended with having the passion for 340B and striving to get as high as I could with learning about it.
Awesome. Chris,
My-
how'd you get here?
Yeah, my experience is even more different than LaNika's.
Even though I regularly assign a pharmacy technician license to you.
Yeah.
Honorary license.
I am not a pharmacy technician, but yes, that has been done several times. So I really started out in healthcare administration. I was in the Army Reserves, and so I spent 3 years on active duty, and I was a healthcare administrator.
What does that entail in the military healthcare administration?
Well, it can be a whole lot of different things because they group a bunch of different functions under healthcare administration. But what I was doing was working with like the combat units, managing their combat medics and their medical programs in general. I got through into the fire right off the bat going to Afghanistan.
Oh, yeah.
Oh my.
And I started out as they called it an evacuation manager. So I managed all the medical evacuations within our area in Afghanistan. And then I moved down to being just a battalion medical officer where I had the combat medics I was in charge of. I spent those 3 years on active duty, and then I came back to my hometown in Greenwood, South Carolina, and I managed to get a job as the family medicine practice manager for the health center there. And that started my health center journey. And so I did that for about 10 years, and then I went into doing financial analysis and 340B compliance. And it was the same.
What
as
kind
far
of
as
prompted
part.
that transition?
Well, I had to go spend another year on active duty. And so while I was gone, someone had to, of course, backfill my position.
Gotcha.
And when I came back, there had not been a 340B compliance manager or financial analyst. And so they basically created a role for me to fill that was needed. So,
And that's an interesting spin on it because we're all coming from a pharmacy background, either pharmacist or technician, but that tie-in with finance, it's really true of what 340B is, in that it touches so many different areas in the covered entity.
yeah,
Finance
actually,
as well as, I mean, the operations and compliance background that you had, both as the facility manager or practice manager and your time in the military.
You're talking about the tie-in to finance. They really wanted the position to live under finance. So I reported to the CFO, which of course I was doing financial analysis as well. So that helped. That helped with that. But what you were saying about kind of being thrown into the fire, yeah, that was definitely a thing. I mean, my health center had some people that were knowledgeable about 340B, but I just kind of had to dive in head first myself to get the knowledge that I wanted.
What did you guys think was kind of the most challenging part of your journey, or the hardest thing to overcome, particularly where you were both more or less kind of thrown into the deep end?
For me, it was the lack of information for specific to to the grantees, and having a lot of hospital information and weeding through that. But then not just that, after you dive headfirst into learning it and trying to implement the compliance to people that don't know the program was the hardest. So it's like teaching 340B to everybody that touched it so that you could get it compliant. So even the CEO and CFO, they knew around the grants and OPACE that had to be
Very basics.
very basics, but not the day-to-day compliance that went into running the program. So figuring that out was by bumps and bruises, where do you start?
Trial by error.
Yeah.
And I think it's great. You now host our 340B Ladies Who Lunch and Learn, so you're able to give back that education that wasn't available when a lot of us started in the program. There wasn't much available online.
And there's a lot, I mean, in general, there's a lot more diverse 340B resource
Resources.
support,
Mhm.
for all covered entity types. I know for health centers, that was a big need. We also see a lot more for, for Ryan White's, the more rural hospitals or the ACA hospitals that got added in later on.
And then my entity, they were like, okay, listen to some conferences to learn. And I would come back with a list of things that we should be doing, but not know where to start. So it was really looking at all the pieces and trying to figure out how they came together to make it a compliance program.
All those early conferences, whenever you first get into 340B, it's like drinking from a fire hose. You go and you just get so much information.
And I feel like as you're learning 340B, you go to the conferences or you sit through. I always say you sit through a 340B University day. You're drinking from the fire hose, and you know just enough to panic. Is how I felt
Exactly.
personally.
Yeah.
Even though
Yes.
you're doing a lot of the things that need to be done, you understand just enough of it to think, oh my gosh, we're not doing anything
Right.
we need to be
Yes.
doing. And then you can as time goes on, you're like, oh, we were doing this right, or we are doing this right. It just was, I didn't see the full picture yet.
I think your job description grows with every conference because there are tasks that you should be doing that you don't know that you should be doing. And you come back and it's like, okay, let's add this task to the 340B compliance.
Mm-hmm.
What was your biggest hurdle with learning 340B?
Oh, all of it. Yeah, I mean, I had people that were knowledgeable at my health center, but right away I started with the 340B University on Demand, and then went to a live university after that and started the ACE certificate. And I mean, it was just a whole lot of information right away.
Well, you had an extra hurdle because you had to learn things about pharmacy. That's its own
And
language.
finance at the same time,
Yeah.
because that was kind of new too.
Yeah, and I think that's interesting because as a technician, when I'm looking, say if you're doing audits, and the provider put the order in for a brand name, and it was filled for a generic. So thinking about a person that has no background,
I did a lot of
Googling.
Googling to begin with. What's this drug for?
Yep. I'll tell you, our health center had, until I want to say maybe the last 2 years I was there, the providers would free text in all of their
Oh my.
their drug administrations. So they weren't in discrete fields. We couldn't report anything, but it would, sometimes it would be spelled out phonetically. We had a couple providers with pretty profound dyslexia. So you had to sound it out and then look at the keyboard and see what
What
the
it
letters
may
were
be.
near. Yeah, because it didn't necessarily translate to anything close to a drug name. And that was hard enough to deal with the pharmacy background, let alone having to learn that at the same time.
I just ran into that. I was helping someone and I forget that sometimes we have people working in 340B that don't have a pharmacy background, so they don't know that medroxyprogesterone is the generic for Depo-Provera.
Yeah. Through the years, I've learned a lot of that, which is probably why Chelsea wants to get me in honorary pharmacy tech license.
Every time I write his name into something, I give him credentials he doesn't have.
I think thinking about the journey, a lot of times we meet people at conferences and they're freaking out because they've learned something in the session and they don't know where to start it. And I'm just like, calm down. I promise you, 340B isn't taught to anybody that goes into it. Most people are starting just where we all started, with figuring it out. And it's okay to figure it out or use your resources around you to not be discouraged that you don't come into the position knowing all things 340B. I think it's kind of the most common thing we hear when we're talking to other people, that everybody kind of dived head first into it.
And I think we're now in a different situation than we were previously, that in addition to just the weight of learning 340B, you also feel the weight of the financial viability of your entity on top of you, because with manufacturer restrictions, Inflation Reduction Act, AMP cap removal, there are all these things that are they're shrinking the program more and more. So you have that stress and anxiety that you're worried about your organization as well. So that's just a lot, especially if you're new to the program.
And I think to add to that, thinking about it a little different with people with different backgrounds. So when you're looking at the problems, a pharmacist might have a different solution from what, say, Chris, a finance guy would have. So
Yeah.
sometimes it's beneficial to have the different pieces from the different backgrounds when it comes to finding solutions with 340B.
Yeah, we look at things totally differently.
We talked about kind of the biggest challenge or hurdle in your journey. What are you most appreciative of in your journey? You know, like what, if you had to point to, obviously one thing doesn't make you successful. It's a combination of experiences and things, but what are you most appreciative of in your journey into 340B?
I think just learning the impact that 340B has on communities is what kind of drove me to really want to dive headfirst and learning about it, that there are patients out there that would not be able to manage their health without 340B. And no, it's not your everyday, the everyday thing you think about when it comes to the compliance, but it all feeds into the being able to provide that patient care to those patients.
Yeah, and that's similar to when I moved to full-time consulting, people have asked me, do I miss the direct patient care? And part of me, yes, but most of me, no, because I'm able to help so many more patients by helping health centers all over the country build great 340B programs.
Yeah, I would agree with that. So like immediately being able to see the direct impact that it has on patients, because even though I wasn't a pharmacy technician, I'm working very closely with the pharmacy staff, and so I hear about and see the stories of patients who were not able to get their meds without the help of the 340B program.
And it kind of makes all the craziness worth it when you think about the effect that it has, and that, hey, we may not be able to have a behavioral health clinic for our kids to go to if we didn't have 340B. So learning more about it all feeds back into that, just the mission of 340B, and that was my driving force.
Yeah. Around when I was getting ready to leave my health center, they were getting ready to start expanding behavioral health services that wouldn't have been possible without our 340B program. So
If you were to be able to give advice to someone, I'm thinking about in healthcare, particularly these days, a lot of aspects of the healthcare system don't necessarily have robust career ladders within them. So if people are looking, you know, they're in a pharmacy technician position, practice manager, or director position, or even looking at your patient service representatives or MAs or RNs, if they're looking for ways to maybe pivot their career or look for opportunities within 340B, what advice would you give to them and kind of navigating or exploring this career option?
I think for me, the positions wasn't there because the C-suite didn't understand we needed them. So sometimes it takes you educating the leadership about what should be being done, and don't be discouraged because there isn't a position there. It may be room for them to create the position once you educate them on what the missing pieces are. Um,
I think
I-
every single one of us went into a position that didn't exist before we occupied it, and I think that that's a testament to the reality of that.
And it took being driven or just doing nobody did the research for me when it came to, okay, where do I go from here? I kind of had to take ownership of researching it and presenting it that, hey, there are entities with 340B coordinators and this is the job description. And it wasn't that they didn't want those things available. They just was not educated that was an actual role that could be provided.
And there's so many more resources available now, even for grantees. So again, you're going to have a lot to learn, but there are resources out there. You have colleagues at your other health centers that would be willing to help you learn and point you to different resources. And there's just a whole lot more out there today.
I think one thing that I did when I got ready to pivot, a resource that I used was the Pexis template for job descriptions. And I kind of took it and read it, and there were some things listed that I wasn't doing, that just reading through those job descriptions made me understand more of what was out there and that what needed to be done for 340B. So I think that's a great resource that you can use if you're trying to pivot or figure out where you can go from there.
One of the things I've told people if they're trying to justify a job is a lot of these positions can come with potential revenue growth, because you may not be running your program as efficiently as it could be if you didn't. If you had this position, you're going to maximize your ability to run an efficient program and find new opportunities to help your patients. Maybe that's opening an entity-owned pharmacy like Chris and I help health centers do. Maybe it's identifying contract pharmacies that you aren't contracted with and increasing that capture rate at your contract pharmacies.
We've got kind of self-education, self-advocacy, educating the leadership within the organization, looking to, a lot of education, looking to, potential financial benefits. The only other thing I'd toss in is mentorship, whether that's general professional mentorship is wonderful, but also if there's not a 340B expert within your organization, and you've identified, we are a 340B covered entity, but we don't really have one person that is taking the helm on that. Looking to other similar organizations in your community, or going and reaching out to the larger national community, looking at 340B Health through NAC.
Your state PCA or hospital association?
Yeah, and looking for people who would be willing to be your mentor to guide through that process for you, and set up meetings, once a month even, to just touch base and see how things are going, because I think that it's a lot, if somebody else has had to fight all of these fights to get to where they are today, you may as well, leverage their experience to make your road a little bit smoother.
And I think we've probably all had mentors in this room, and we've probably all been mentors to others. And that's a great thing about the 340B community. We're family, and we're going through the same pains together. So in addition to getting those mentors, you also have to develop ways that you have self-care, because this can be a very stressful job. We love it. We love the stress because we're making a difference, but we got to take care of ourselves too.
Yeah, making those connections, like you said, for both self-care and just mentorship with somebody that understands it, because we can go home and talk about 340B with our spouses or our families, and it's like, what is 340B? What are these letters and numbers you put together? So I think a big part about it is making connections with others. Like one of the first conferences that I went to, it was very beneficial for just that reason of connecting with someone and discussing what their health center is doing versus what mine is doing, and taking all the knowledge.
You add me to a call recently that you still have a mentor relationship with someone from like one of your first 340B conferences from years ago, and you still
We still
keep it going.
we still touch bases because her and I were in similar positions where we didn't have a lot of FQHC information. So she would figure something out and she would call me, or I would figure something out and I would call her. And for years
It wasn't even so much mentorship. It was just kind of
it was just
navigating together.
navigating it together. And I started to do that for multiple people that I would meet. And it was kind of like consulting before I became a consultant, because if I learned something and I knew that somebody else I spoke with didn't know that, I tried to always share the information.
Well, this has been wonderful. Thank you both so much. We're so glad to all be a part of the same team, but also glad to have you share your experiences today.
Thank
Thank
you.
you.